Welcome to EASL Studio, your weekly hepatology broadcast news. In today's episode, we have a very interesting topic, from evidence to action, reducing alcohol-related harms. I'm Shira Zelber-Sagi. I'm the chair of the Public Health Policy and Advocacy Committee of EASL, and I have an amazing faculty with me today, which I'm proud to present. So first, we have Debbie Shawcross, the Vice Secretary of EASL, which is also a hepatologist in her free time. We have Frank Murray, which is a member in the Public Health Committee of EASL, and we are so lucky to have him. He's a world expert in alcohol advocacy and policy, and he leads the Alcohol Health Alliance, which we will discuss today. And I'm mostly honored to have Catherine Paradis from the World Health Organization Regional Office for Europe. She's a well-known expert in alcohol policy and advocacy, and she will bring a different perspective because she is actually a public health sociologist. So good evening, everyone, and I'm really happy to have you with us today.
Good evening.
Good evening. So I will start with an interesting issue. On May, we are going to have in Amsterdam, as you all should know, the EASL Congress. And during the EASL Congress, we are going to launch and celebrate the Alcohol Health Alliance initiation in collaboration with WHO, as led by Catherine. I would like to ask Catherine and Frank to tell us a little bit about this alliance. What is it, and how it all started, actually. So Catherine, you go first, please.
Yeah, maybe I can go first and say a little bit about the story of this beautiful alliance. Within the office here at WHO Europe, we have this grant that we received from the European Commission that is titled EvidAction. And it's all about transforming all this evidence we have about the impact of alcohol on health and well-being into actual policy. Policies that favor public health and public security. What's very tricky with my field is that despite all the evidence that we have a real hard time getting traction on transforming it into those policies. So we kind of started looking at ways that we could achieve that. And of course, one of them is if we have strong, credible voices like those of medical doctors that would speak in favor of those policies. We knew it was a turning point for the fight against tobacco, and we strongly believe it could be the same for alcohol. And so I was going around Europe and a little bit trying to find who could be an ally and who could help us to set up a network of medical doctors, of medical organizations that could achieve that. And then last June, I met Frank at the EASL conference. And I think I'll turn to you, Frank, and allow you to continue to tell the story of this alliance.
Well, thanks very much, Catherine, because while you were working at that, we were in EASL working towards a vision of a European Alcohol Health Alliance. And how that started really was we put together a policy on an EASL policy on reducing alcohol harms, and that was done through this committee that Shira now chairs. And when we put that, the next step we saw from that was establishing the European Alcohol Health Alliance, and it was a great pleasure to meet you and find out that you and WHO had the same desires. So it's really been a partnership. It's very much a partnership, and we're delighted to be collaborating with WHO Europe and yourself and your team in relation to this. And the reason we think it's important is because the alcohol industry is excessively influential in terms of alcohol policy in Europe. It's seen as a trade issue rather than a health issue. We would argue that alcohol should be seen as a crime issue, a social issue, and particularly from our point of view, a health issue. So we are very interested to reduce alcohol harms, and we really see this alliance as a way to do that. Now, the reason we think it's so important is because we also agree with you about the evidence-based policy that works to reduce alcohol harms is absolutely clear. We know what works, and we can discuss that later on. But there is an implementation deficit disorder, I would argue, in terms of our failure to implement that. So these policies. So this is a great opportunity, I think, through this alliance. We're bringing together medical voices, clinical voices, to act together, and the alliance will be launched at the European Association for the Liver meeting in in May in Amsterdam with representatives from WHO Europe, from EASL, and from other medical organisations. So we're delighted with that, and thanks very much indeed, Catherine and WHO.
It's a really exciting collaboration, and Debbie, as the Vice Secretary and soon as the General Secretary of EASL, I'm sure you would like to emphasize the importance of reducing alcohol harm and the importance of the Alliance, so please.
Absolutely. And I think it's really important to say that sort of as hepatologists, as as liver doctors, we spend most of our time looking after patients who present far too late when the damage is already done. And it's so frustrating that we can't have more impact. And actually the way forward, and I think this is the way that we're all realizing now, is actually we need to step in very early on and change the way we're thinking about alcohol as being an issue in society, involving society as a whole, and actually really focusing on policies that we can actually help to reduce alcohol intake across the globe, but specifically in Europe, where it's been a huge problem.
Thank you. So we all have very good intentions and great plans, but what are we facing really is a very, very strong industry. And we know that the alcohol industry is doing a very aggressive marketing of alcohol, also among children and adolescents, also among populations with low education, low socioeconomic status. What is your take on that? How would you describe the marketing strategies, and how can we overcome those aggressive strategies? Let's start with you, Catherine.
Yeah, well, you talk about the marketing strategy, but I'd like to take a step back because yes, we are facing a very strong industry that is doing everything it can to increase its profit margin. It's their job. That's what they want to do. They want to sell more alcohol. But we're also facing an awareness deficit. Frank was talking about an implementation deficit, but there's an awareness deficit. And, when Debbie's talking about, it's too late and we need it's frustrating that we can't address this earlier. And what's even more frustrating is that many people drink without knowing that it's unhealthy, that it may be causing their harm in the long term. People just don't know. If you would know how many people in my life with whom I said, that alcohol can cause cancer, and they go, cancer? Really? They're just unaware. So it's also that we are against, this lack of awareness in an alcoholic culture, and this is where the industry comes in, where the marketing comes in, where the industry has created a society where we've become, it's become unthinkable to have fun without alcohol. It's as if, if you want to have fun, if you want to have success, if you want to be sexy, beautiful, and so on, you need to have alcohol. And there's also a flip side to that, which is so sad, is that then we're creating this belief among people that if they are having an issue with alcohol, if they don't like it, or if they have a problem, or if they should develop an alcohol use disorder, they have a problem. We're making it believe that it's their fault because look around, everyone seems to be having fun with it. So, yeah, marketing, and I'll let the colleagues speak about that. But I wanted to really set the stage about this complete lack of awareness about alcohol and its consequences on people's life and also on society and so on. But I'll stop here.
Absolutely. No, everything you describe is actually affected by the marketing strategies, creating the social norms that there is no fun without alcohol. But I want to ask you another question. I know you were involved or even led the Canadian guidelines, and I know the Canadian guidelines are very strict about what is the safe alcohol upper level or any level safe consumption of alcohol. Can you say a few words about it?
Yeah, I can, but then I would really like you to reinvite me because that's a whole
so just shortly
episode on itself. But yeah, what we did, Before joining WHO, I happened to have a great privilege of co-chairing a very important project, which was updating Canada's low-risk drinking guidelines. And what we did, really, if I should sum it up in 30 seconds, is that we looked at all the meta-analysis that we had, and we created we did some modeling to establish which average of alcohol consumption was associated with which level of premature death. And what we found, to our surprise, I have to say, we all knew that the numbers would be lower than what had been circulated in the past, but we didn't think it was going to be that low. And what we found is that at 2 drinks per week, not per day, but per week, your risk of a premature death is 1 in 1,000. And if you go to 8 drinks per week, your risk of premature death then increased to 1 risk of premature death in 100. And then the risk is exponential from there. So this was very shocking to people. And we had to be very careful in the way we communicated that. And I think that will loop us back into today's discussion, because one key message that we put into that report is that while we know that encouraging Canadians to reduce their alcohol was difficult, we knew it was difficult. We also knew that governments needed to help. Governments needed to step in to help Canadians make a difficult decision about their alcohol use a little bit easier. It's not easy to reduce your alcohol intake when you're surrounded with marketing where alcohol is cheaper than water or a bottle of ketchup at the grocery store, and where it is available 24/7. So governments need to help those who would like to reduce their alcohol use for this difficult decision to be easier. Yeah.
That's great. And we definitely use this recommendation, by the way, in our papers now in the EASL Commission. So thank you for that. Frank, I know you have a lot to say about policies and also pricing of alcohol. So give us your take on that.
Well, the evidence-based policies are very, very clear in terms of particularly availability, advertising, and most especially price. So price is cost affordability is the most important single issue determining alcohol sales. And if we want to be serious about this as countries, I think we really need to increase price. Now in Scotland, Wales, Ireland, we have minimum unit pricing now, which has been very effective, I think, in reducing the availability and the sales rather of ultra cheap, pocket money cheap alcohol. And data from Scotland is very convincing. It's shown a 30% reduction in mortality associated with alcohol and a 4% reduction in hospital admission. So really convincing evidence on top of the extensive evidence we have on just cost. Now, interestingly, Europe is the heaviest drinking region in the world. And that is reflected by the fact that in most countries in Europe, alcohol is incredibly inexpensive. And in 22 countries in Europe, there is no excise duty on wine, for instance. So we've got this sense of complacency, I think, around alcohol consumption in many countries in Europe. And we know what works, as I said. So price is the most important thing. And it's worth saying, too, an attractive thing about minimum unit price is it protects children. Now, I think we get a fail in terms of child protection for alcohol consumption. We know that 15% of children in Europe have been drunk by the time they're 15. That's absolutely shocking. It's indefensible. It means we're failing in protecting children. So, and I think that we need to particularly focus on that, because the alcohol industry, which you mentioned earlier on, Gira, has no argument against that. We also know that there are harms to children from drinking at that age, that their neurodevelopment is impaired by alcohol. So I think we need to look at things like pricing, advertising, and availability critically. We know what the answers are. We know what the effective policies are. What we need to do is have better implementation. And that's why WHO and Europe are coming together to form this alliance to try and make our voices heard to improve policy implementation. Thank you.
And Frank, actually, the revenue from the taxes can be used to cover for the health cost that alcohol causes, right?
So if you look at the cost of alcohol to society, when you include those three categories that I mentioned earlier on, it's estimated by WHO and OECD and other academic researchers that 2% of GDP, it's a shocking amount of money, is spent dealing with the costs of the harms of alcohol. And the industry doesn't pay that. The industry pays small amounts, relatively speaking, of excise tax in many countries. And who is picking up that cost of alcohol? The taxpayer and the exchequer in the various countries in which we live. And that's wrong. I believe the alcohol industry should be levied to pay for the costs of alcohol harms. And in fact, that would be quite useful because it would increase the cost of alcohol, which would in turn reduce alcohol consumption and alcohol harm. So there's a virtuous circle there. So I think that's something we should look at, very important. And we should argue for that, I think, through the Alliance, for instance.
That's great. I wish it will be implemented. And Debbie, how do you think we can improve implementations in more countries of these measures?
That's a difficult one. But actually, just before we come to that, I just wanted to bring up binge drinking, actually, because I think this is a real issue. We've talked about young people and adolescents being particularly vulnerable to the harms of alcohol. And you often, when you meet people in clinics, they'll say, well, I don't drink every day, doctor. I only drink on a Friday and Saturday night. But one of the huge problems I think that we're dealing with in society is actually a large number of people drinking very heavily in binges. And when I say a binge, that's only 6 units of alcohol in one session for a woman, and possibly 8 for a man, but probably even 6 for both. And what industry is really promoting is the attractiveness of sort of going out and drinking all of these lovely, pretty coloured drinks in wonderful containers and making it really fashionable. And this is a huge, huge problem. And I think we need to make sure that we address binge drinking as much as we do in those people who sort of are heavy alcohol users on a daily basis. And I think that's really, really important piece of work that we need to take on with our policy.
Definitely. And now alcohol labeling with a warning that alcohol causes cancer is a very hot topic. It is discussed a lot. It was proposed by several public health organizations, but it's very poorly implemented. I think just in 2 or 3 countries. I'm not sure even it's cancer warning. Usually it's drink and drive and not to drink during a pregnancy. How can we, what do you think about this low-hanging fruit policy measure, and how can we make sure it's implemented? Because we know it's effective. Studies show that it is effective. So we will go as usual from Catherine.
Yeah, I'll go first, and once again, before jumping to warning labels per se, you know, I've been talking about the Canadian guidelines, and I was saying 2 drinks, and then I said 8 because I was converting in European number of drinks. Actually, in Canada, it's 6 drinks, and then Debbie's talking about units, which probably is 8 grams of alcohol in the UK. In the Europe, it's 10. In Canada, it's 13.45. So the point I'm trying to make is that even when you open a beer today, you have no idea how much alcohol you're actually taking. We provide recommendations about certain numbers of drink, but what is a drink? No one knows. Nothing is properly labeled, and you know, especially now with the rise of all sorts of craft beers, you have IPAs with very high level of alcohol, others with not. Consumers have no idea what they're consuming in terms of sheer quantity. It's a little bit as if we were putting drivers on the road and removing the speedometers from their car, and we're going, you know what? Don't exceed 100 kilometers an hour. And the only tool at your disposal is getting your head outside of the window and seeing, you know, about how fast you're going. So we need label to inform consumers, first of all, about the quantity of what they drink and what it is that they drink. And then, of course, there's also the whole issue of the health warning. And it's just basic knowledge that people should have a right to. Of all the products that are out there for consumption, all of them are labeled except alcohol. What is so unique about alcohol that suddenly when we consume it, God forbid, should we know what we are drinking and what are the risks associated with
and the
that,
calories?
Yeah,
Well,
it's just so people, should have the right to that information. And WHO just came out a couple of weeks ago, with really this big report on alcohol health warning labels from a public health perspective. And in there, it's very clear that labels have is a unique tool at the point of pour to convey information to consumers, and nothing else can achieve that better than label right on the bottle.
yeah, thank you, Catherine. Frank, very shortly, please, because we have some interesting topics to discuss.
Yeah, well, to me, the question is not should there be alcohol warning labels on the bottle, but how have there not been alcohol warning labels on the bottle when the evidence is so clear for so long of the harms of alcohol? That is particularly emphasized to me by the fact that most people don't know, for instance, that alcohol is associated with the risk of cancer. About a third of people only recognize that. And also people don't recognize that at even low levels of alcohol consumption, cancer risk is increased, and particularly that applies to breast cancer in women. So there's a huge area, I think, of not understanding the role of alcohol in cancer. Also, alcohol consumption during pregnancy and during conception actually is potentially very harmful. And it's estimated that at least 2% of people in Europe, 2% of people in Europe have FASD, fetal alcohol spectrum disorder, as a result of alcohol consumption. So, and in addition to liver disease, because the tragedy of liver disease has already been outlined by Debbie, that most patients who present with liver disease, by that stage, their disease is irreversible and they're going to die without a transplant. And it's that alcohol is unfortunately the commonest cause of death by a great distance for liver disease. So it's really important that we have labels that outline these risks to people clearly and in a way that they will remember. Thank you.
Thank you. Debbie, I would like to ask you a different question about protecting children and adolescents. What is the situation of alcohol consumption in Europe among children and adolescents, and what are we going to do with it?
It's shocking, actually. So there was a report published by the WHO back in the summer last year that outlined how much alcohol adolescents were drinking. So that's 11-year-olds, 13-year-olds, and 15-year-olds. And as I think Frank already mentioned, about a third of our adolescents are drinking regularly, which is really scary. If I was to tell you that about 18% of 11-year-olds have been drunk twice in their life and have drunk in the previous 30 days, you'll be shocked. Why are 11-year-olds drinking at all? And it just gets worse and worse and worse. So by the time adolescents reach adulthood, they're all regularly drinking, or they're binge drinking, as I mentioned before, and they're doing harms. And the problem is then that they have these habits then for the rest of their life. It becomes normalized, and they just continue to do that. So what we have to do is, I think, raise awareness, particularly to parents that actually, to make them think about whether their children are drinking, and if they are, what can be done about it. It is just really, really worrying trend, and it's only increasing.
Yeah,
Can I just jump in here? What I find extremely shocking with that also, and that throughout my career, I've spoken with parents, and giving alcohol to their children is a law that parents are willing to break all the time. You ask parents, would you give the card of your keys to your 14 years old? Of course, I would not do that. No, why wouldn't you? It's against the law. Would you steal some cakes in the shop for your kid? No, of course, I would not do that. It's against the law. Would you give alcohol? Oh, yeah, that I would. Why? Well, everyone does it. So it's also, what kind of signal are you giving to this generation when, parents are willing to break the law for that? It gives, all the wrong messages. And this is something we need to address as well.
And I think industry really plays on that as well, because they then want to target and advertise alcohol to be attractive to adolescents as well, so that once they've had their first taste of alcohol, that's it. It's really, really difficult to then influence any change.
Mm-hmm.
Yeah, sometimes they go to schools and educate about safe drinking driving, which actually normalizes drinking at all at those ages. So, Frank, do you want to add something, but very shortly, please?
I didn't, but I will just say that it is interesting. There is no such thing as safe drinking, in the sense that alcohol, there is no safe level of alcohol consumption. It's interesting. That's one of the taglines in the kind of Canadian guidelines, and also WHO Europe, and also the Lancet published an editorial in relation to that recently. So the idea of safe drinking is a ridiculous thing. Alcohol is harmful in all quantities, and one drink or two drinks may be enough to put you on your bicycle, cycle home, and get run down. So it's really important that we address that issue, that there is no safe level of alcohol consumption.
Yeah, thank you. Can we now be more optimistic? And can any of you share very shortly a success story of implementation of policy in one of the European countries? We will start with you, Debbie.
Yeah, so I'm going to talk about something I learned about when I'm talking about looking at the adolescent drinking. And this is something that Victoria Cronston, who led a fantastic editorial that you must read, that's in this month's Journal of Hepatology, talks about. But in Iceland, they had a program called Planet Youth. I'm not sure if people are familiar with that. And this is basically reducing alcohol consumption and harms using a whole of society approach. So actually getting society on board. And it's a model based on prevention of consumption through enhancement of the social environments that adolescents are growing up in, and reducing known risk factors and strengthening sort of protective factors and behaviours. So it's about the whole society shaping behaviours of their young. And it's had a huge impact on alcohol use in Iceland. And I think that's a fantastic example.
That's great. Catherine?
Yeah, I just had the immense privilege of a couple of weeks ago of going to Lithuania, to Vilnius, where we shared result of a real life experiment that's been happening over there, where for years now they've been implementing alcohol policies and recording the results of that. And I mean, the results are just incredible, and when, sometimes physicians, for example, could think that alcohol policy is very, very far away from their everyday life. But what has been happening in Lithuania shows us that no, it's actually very close. So, concrete example, they increased the price of alcohol, and that automatically led to a decrease in the prevalence of intoxication among youth. So that's a direct impact on emergency room admissions and the amount of work that pediatricians have to deal with. The same thing with marketing ban. When they implemented a full marketing ban, the number of intoxication among youth significantly reduced, again, with an impact in emergency room admissions. The one that I'm really fascinated with is that they decided to reduce the availability of alcohol on Sundays, and they reduced the number of hours. They closed the shop earlier, at 3:00, I think, on Sunday. And what happened then is that there was an immediate significant reduction in the number of accidents and injuries. So once again, direct impact on the jobs of emergency physician. And here's the interesting thing, an immediate impact on the number of cardiovascular incidents on the Monday. You reduce availability on the Sunday, and you have less admissions to the hospital, into the cardiology department on the Monday. So it's just fascinating. And we have those results. And what has happened in Lithuania is really a real life experiment. And I know that some countries and some policymakers will look at that and go, oh, but it's just a small country. I've been there. Lithuania is a vibrant, dynamic society that is leading on lots of fronts, including digital health, for example. And I have no idea why they should not be the poster country for the implementation of alcohol policy.
Yeah, that's amazing. And we should just duplicate their success stories. Frank, what is your success story?
Well, first of all, I'd agree with both Debbie and Catherine in relation to those two success stories, which I think are very important, that we interpret those as being a way to go. So I think what they've done in Iceland, they've not just eliminated childhood alcohol consumption, they've virtually eliminated smoking among teenagers and drug use. So it's been a stunning, as you said, whole of society approach that I think is a great example of what we could do. And also Lithuania has really shown a tremendous way forward. And in contrast to Poland, where they've gone the opposite direction through reducing restrictions on alcohol sales. What I want to talk a little bit about in this situation is warning labels for cancer in particular. And that's warning labels, including cancer warning labels, are going to be introduced in Ireland. It's been legislated for, and they're going to be introduced in May 2026. It's just something I think that we should celebrate. And it's interesting that it's happened in Ireland. Ireland's a small country where it's possible to achieve things, I think, constructively for lots of reasons. But I think that just as the workplace smoking ban began in Ireland, I'm very pleased to see the alcohol warning labels beginning in Ireland, and I hope that they will spread across Europe like the workplace smoking ban has, because it's very low-hanging fruit. And if I could just say, one of the interesting things to me about evidence-based policy, which we know about, is that it's very cheap to implement. It's not, you don't have to build motorways and bridges and tunnels. It's very cheap to increase taxes and price. It's very inexpensive to restrict advertising, and very inexpensive to restrict availability. Those things that Catherine just talked about. So that's what I'd like to leave you with in terms of prevention.
It's a very optimistic note. So we will end with this optimistic atmosphere. And I would like to thank you for a fascinating discussion, which we will continue during the EASL Congress on May. We are going to have, I'm sure, a great session together and launch the Alcohol Health Alliance together. So thank you so much. I really appreciate you joining this episode today. And of course, join us for the next episode of EASL Studio as we discuss rare liver malignancies. And of course, as always, remember to become an EASL member and join the EASL family. Thank you so much and have a nice evening.
Thank you.
Thank you
Thank
so
you. Good
much.
evening.
Thank you very much.